Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Lila Azzahra Bermuda with NPM. So today I will make a video about a nursing journal with title Spiritual Emotional Freedom Technique to Improve Sleep Quality for Postpartum Mothers as an English practice assignment. So enjoy the video. Postpartum or puerperium is the period after childbirth to restore the reproductive organs, which lasts for 6 to 8 weeks. Postpartum mothers experience various health problems, including decreased sleep quality. Mindel, Sadeh, Kwon, and Goh 2030 reported that about 54% of postpartum mothers had problems with sleep quality, and this condition was also reported 50.9% in Malaysia and 77.8% in Japan. The fundamental health research in 2018 showed the prevalence of sleep problems in postpartum mother was 78.7% and Central Java 57.6%. Research described that postpartum mothers who experienced mild sleep disorder were 45.16%, 29.3% moderate sleep disorder, and 25.81% for severe sleep disorders. Spiritual Emotional Freedom Technique or SIFT is a therapy that uses spiritual elements to reduce physiological and physical problems caused by emotion. SIFT therapy was developed from the Emotional Freedom Technique or AAFT, which combine of science of acupuncture with behavioral techniques in psychology. This therapy used the finger to tap energy points with a certain number of beats and sequence, performed in conjunction with positive affirmation, several relaxation technique, and visualization. SAFT has advantages including having no side effect, being easy to apply and anyone can conduct. The provision of SAFT is expected to impact postpartum mothers, especially on sleep quality, positively. Research subjects were 56 postpartum mothers treated at Sultan Agung Islamic Hospital in Semarang. The study used a randomized sampling technique. The inclusion criteria in this study were postpartum mothers who were legally married with the desired pregnancy, able to participate in this research for 4 weeks, underwent normal delivery, had a good level of consciousness, and had passed the psychological adaptation phase of taking hold. In contrast, postpartum mother with sectio sesar passed the adaptation phase of taking hold. The exclusion criteria from this study were postpartum mothers who received drugs to treat sleep disorders, experienced postpartum bleeding, infection, postpartum pain, sectio sesar, or severe perineal pain. Poor sleep in postpartum mothers can be psychological, caused by irregular sleep pattern due taking care of the baby, fatigue, puberty, and age. Poor sleep quality is also associated with depression, lack of relationship with a partner, previous depression, depression during pregnancy, and stressful life. Family support has a positive effect on reducing the incidence of postpartum depression. The intervention results show that SAFT could significantly improve the sleep quality of postpartum mothers rather than the control group who receive standard intervention in the form of physiotherapy from the Islamic hospital. The results are also in line with previous studies conducted on the elderly, where there was a significant improvement in sleep quality before and after given SAFT. Therapy contains calming words accompanied by a prayer to calm the body and mind. Besides, SAFT makes breathing and heart rate more stable and blood circulation becomes smoother. It was easier to initiate sleep. The results of this study were consistent with the benefit of SAFT from previous studies. SAFT is proven to benefit postpartum mothers who generally experience sleep quality disorders. The SAFT interventions is easy and can be done independently. It can be done twice a week for 8 weeks at night before going to bed. It has been shown to significantly reduce the total score of sleep quality disorder in postpartum mothers, even though the score is not included in good sleep quality. After the intervention, the four components that can be improved are subjective sleep quality, sleep latency, sleep duration, and sleep disturbance.